Cambodia is a country located in Southeast Asia bordering Thailand, Laos, and Vietnam. As of this year, it has a population of 60 million people, with 80% of the population living in rural regions and just 19% in urban areas. Cambodia has a constitutional monarchy with a parliamentary representative democracy. Today, it is a stable country. However, it has a history of political unrest, with the Khmer Rouge rule in the 1970s, which caused the Khmer Rouge famine. This famine disrupted Cambodia's agriculture, health, and education systems. It also had an effect on the economy, and even with the significant progress made, the country still remains one of the poorest and least developed countries in Asia. Nevertheless, health outcomes in particular have improved in recent times. However, undernutrition among children remains to be one of the most prevalent health issues. Child undernutrition is a health burden on Cambodia, as it is a well-known underlying cause of significant child mortality, contributing to approximately 45% of child deaths. Child undernutrition has long been identified as a global health issue with wide-reaching consequences. To some, undernutrition can simply be inadequate food intake. However, current scientific knowledge has progressed beyond this and come to understand that undernutrition can present itself in many ways and is reliant on a number of factors such as type of nutrients absent and age. Universally, a child is considered undernourished if they experience stunting, wasting, or are underweight. Stunting refers to children who are below the average height for their age. Wasting is considered as a child whose weight is below the average for their height, and underweight is defined as weight below the average for their age. Statistics from the 2014 Demographic and Health Survey reveal that undernutrition has since been reduced. However, stunting still affects 32% of children under the age of 5, and 24% of these children are underweight and 10% are wasted. These statistics also show that undernutrition is mainly seen in children who come from low socioeconomic background and live in rural areas. A child born to a mother with poor education or who is undernourished is also more likely to be undernourished, therefore continuing the cycle of undernutrition into the next generation. Child undernutrition can consequently affect physical and cognitive development, as well as impair health and lower the learning capacity. It is estimated that just 45% of Cambodian children finish primary school due to these negative impacts. This often further leads to affect the productivity of the population and in turn can affect the economy. The health outcome of child undernutrition poses a heavy economic burden on Cambodia, which accounts for up to 2.5% of the country's GDP. The Cambodian government has implemented countless strategies, plans, and policies to address the issue of child undernutrition. However, there are challenges that are identified in responding to this issue. The country has limited resources, including lack of human resources, lack of geographic information regarding child undernutrition, and low funding. Additionally, there needs to be better planning between both national and subnational levels, as well as strong links to other sectors, which will in turn bring investments for programs that focus on reducing the statistics of child undernutrition.
Despite improvements in undernutrition, some nutrition determinants still enable the existence of undernutrition problems for Cambodian children. The determinants can be categorized into micro as individual and household factors, or macro which are social, political, economic, and cultural structures, processes or problems and their interrelationships at the regional and national level. Nutrition determinants fall under the three broad areas that determine a child's nutritional status, which are food, health, and care. However, a child's nutrition cannot be isolated from maternal nutrition. Factors not directly related to food, health, and care also impact on children's nutrition. Several studies show these factors as the most common microdeterminants for children under 5 years of age. Parents' education level determines their behaviors and decisions towards everyday living. Often, mothers' education status is reported more than the fathers, since mothers spend more time with the children. Inadequate complementary feeding practices, poor health and nutrition practices in families, poor hygiene, and high prevalence of diseases contribute to children's nutrition outcome. Although gender is mentioned, there was not much difference in undernutrition problems observed between the male and female children, and the older the child, the more chance of observing stunting due to growth retardation. Other microdeterminants also contributed to undernutrition. Most of these individual determinants directly affect the child's physiological condition, resulting in stunting, wasting, underweight, or deaths. Apparently, most of these microdeterminants resulted because of the macrodeterminants of nutrition. Cambodia's social and economic structures complicate nutrition for their children and their parents. The 2008 food price crisis persists and contributed by slowing nutrition progress in the country. Poor health and education systems lead to sanitation problems including diarrhea, and lack of education means being unable to know the importance of vaccination and other determinants. Rural and urban areas continue to experience inequities in health and nutrition outcomes and healthcare utilization across provinces between people of different education levels and economic status. Excluding women to take leading roles in the community and make decisions about family issues contribute more to the undernutrition problem. Poverty is still one of the most important underlying causes of high maternal and child mortality and undernutrition. It is a state where families have inadequate income, which also means having less household wealth that cannot sustain a standard living that is considered comfortable for the children and their families. Families face food insecurity by not having reliable access to improved quality and quantity of affordable foods for consumption. Inadequate accessibility, quality, and utilization of health services, shortage of skilled health professionals such as midwives, limited supply of essential drugs and equipment, weak communication and referral between different levels of care, and inadequate linkages between communities and health facilities are major drivers to the problem. Inequitable economic growth and ineffective public health measures further complicate nutrition problems. Undernutrition consequences can continue into adulthood, impairing both mental and physical development that will result in poor performance in school and limited opportunities for work later in life. UNICEF Cambodia reported little difference in the number of boys and girls in schools from 2001 to 2015. Marginalized children from poor rural families, ethnic minority groups, and children with disabilities are more likely to be out of school or not complete primary education. Many children repeat grades and take more than 10 years to complete primary education. Income-generating opportunities from both formal and informal sectors are keeping poor children out of school. Despite improvements in some areas, Cambodia's school learning environment is not conducive. Provision of clean drinking water, toilets, hand-washing areas, and hygiene education are still of low quality and are the major determinants. Cambodians have traditional values, practices, and health beliefs. For some, culture and religion influence everyday living and diet. Challenges from the Millennium Development Goals include nutrition education, breastfeeding and adequate complementary feeding, maternal nutrition, dietary practices for behavior change, funding, and lack of good policy that can integrate nutrition health education with broader health programs and food security programs. Undernutrition in Cambodia has multifactorial causes. Eliminating few of the main macro causes will reduce undernutrition than trying to act on the many micro causes individually. Addressing the macro determinants will also simultaneously address the micro determinants.
Reports from the International Journal of Food and Nutritional Science indicate that many of the children are still chronically malnourished, regardless of government paying more attention to eradicate inequalities in recent years in Cambodia. While the government is nominally committed to solving the issues of malnutrition to improve nutrition quality in Cambodia, a study determined that an efficient effort to allocate resources to combat malnutrition has not been seriously taken into account in this country. Meanwhile, Cambodian government often claimed there is insufficient resources for maternal and breastfeeding related programs to provide nutritional supplements to the poor communities. Between 2000 and 2010, GDP growth in Cambodia averaged 8.2%, which is a remarkable achievement, and it means local government has worked hard to overcome conflict and fragility. During the same period, maternal mortality has dropped by over half and child mortality by almost two-thirds, already exceeding Millennium Development Goals targets. However, it is insufficient only working on a single sector to improve nutrition status among maternal mothers and newborn babies, but requires a multi-sectoral approach, including well-trained maternal and child care practice, accessibility of clean water, availability of health service, and friendly environment for breastfeeding. It is also important to cooperating between non-government organizations, experts, community stakeholders, and other international partners to work with Cambodia, engaging external assistance to achieve the principles of development effectiveness. United Nations Children's Fund is a key partnership, works closely with the government to support the Second, health sector support program in the national level aimed to have mothers and caretakers feed their young children homemade, multi-ingredient rice porridge to support physical and cognitive development. In order to enhance maternal, infant, and young child nutrition, a nationwide education and training were conducted to deliver the message of breast milk values, proper breastfeeding behaviors, diverse diet options, and of potential risks of childhood infection and other disease for all households, which is an effective approach to ensure timely and adequate guiding information for population and improve social accessibility in health sectors. A direct impact on nutritional status by tackling the immediate cause of undernutrition, such as feeding programs, provision of micronutrient supplement, or support for infant feeding. Indirect impact on nutrition status by tackling the underlying and basic cause of undernutrition by improving health status, sanitary conditions, access to better quality of food, or increasing household income. Both strategies and interventions are generally necessary to combat undernutrition, have been established as priorities in order to confront major global challenges.
Now, health does not stand alone. We have just heard that it influences and is in turn influenced by varying social, economic, and environmental factors. Similarly, undernutrition is not a simple health issue. Instead, it has varying degrees of complexity. It is linked to many of the overarching themes within the SDGs that may be considered by some as non-health, such as inclusive and equitable quality education. In order to match this complexity and therefore effectively reduce the prevalence of child undernutrition, it is essential that programs and strategies are targeted at these larger social, economic, and environmental determinants. Over the past decade, Cambodia and other Mekong Delta countries have undertaken a number of community-based child health and nutrition programs. Homestead food production programs are a common intervention within communities, and these focus on increasing the consumption of micronutrient-rich foods for not only children but also their mothers. The increasing cost of high-quality foods has made it difficult for families in the lowest wealth quintile to consume micronutrient-rich foods. This strategy involved providing households with assistance and agricultural supplies to enable the production of a range of fruits, vegetables, and later integrated into programs, small animal production activities. Other widely used community-based interventions focused on providing different types of nutrition education. During home visits, community workers are used to provide education on appropriate diet options. These include breastfeeding options, education on nutritional health issues, as well as how to increase the nutritional value of meals. Vitamin supplementation seems to also make up a large proportion of community-based interventions, particularly the supplementation of vitamin A, iodine, iron, and zinc. The majority of these programs use these vitamins and minerals to fortify the food within communities in order to minimize nutritional disorders such as anemia. Communities are provided with disposable micronutrients, either in the form of sachets or microencapsulated to be added to prepared food. An evaluation of these strategies showed that while they resulted in small benefits to the nutritional health of the children within these communities, these changes did not translate into significant improvements in overall health and nutrition. Research shows that the most effective programs are those that have a high coverage and those that target the social economic determinants of nutrition. The recent Global Nutrition Report highlighted the effectiveness of strategies that reach 90% coverage, stating that they result in significant benefit-cost ratio, especially for countries such as Cambodia. Because of the prevalence of undernutrition in these Mekong Delta countries, interventions have not only been implemented in communities as just discussed, there are also a number that have been rolled out throughout schools. These include the WFP's school feeding program and the Fit for School program brought about by a number of organizations and health ministries. Although the strategies within these programs all vary, there are some key characteristics in addition to those stated above that ensure they are effective. One of these characteristics is ensuring the strategies are based on high-quality evidence. Interventions that are based on high-quality evidence, coupled with high coverage, are able to result in a reduction in the number of child deaths that are due to undernutrition. Another important component of school-based nutrition interventions is cost efficiency. Research shows that malnutrition is amongst the highest causes of poverty in Cambodia and other Mekong Delta countries. However, poverty has also been associated with an increase in malnutrition. It is therefore important that strategies implemented are not placing an increased burden on the healthcare systems of these countries. Finally, strategies targeted at schools should be simplified. Strategies that are simple allow implementation into a school context without requiring a great amount of effort and resources. Now, while school-based programs have had great success in decreasing child malnutrition rates, there is still a large number of children who do not attend primary school, experience high rates of absenteeism, or are forced to drop out. Children who are not able to receive education also miss out on the benefits of these programs. Many of these children originate from families who are not able to maintain a stable income. The economic pressure that comes as a result of this forces many children out of school and into the workforce to supplement the existing household income. Some families are simply not able to afford the expenses that come with education, such as stationery and uniforms. The resulting low levels of education not only affect the nutritional health of children, but often result in additional socioeconomic challenges that increase the potential for future health issues. For this reason, it is imperative that there are strong evidence-based strategies in place. Now, in addition to being evidence-based, recommended strategies need to be multidisciplinary in order to target the various factors that surround low school enrollment and attendance. For instance, primary-aged children who reside in urban areas are more receptive to interventions that are demand-driven. Such interventions involve providing monetary subsidies or scholarships that provide for the high upfront educational costs. It's been found that strategies like subsidies that reduce the pressure of educational costs are effective in increasing both enrollment and attendance rates. An increase in these rates means that children receive more exposure to school and in turn create a potential for an increase in both knowledge and skills also. Now, while these strategies may be sufficient for urban students, those who dwell in more rural and remote areas throughout Mekong Delta countries require additional interventions. Many of these students are forced to travel long distances, and this can serve as a potential barrier to school attendance. For this reason, increasing the availability and accessibility of primary schools is also necessary. This can be done through constructing schools close to residences and also limiting the number of unfinished schools. However, finances and distance are only among the many barriers girls face to receiving primary education. So while a large number of scholarships are being offered to females, widespread values and beliefs limit their effectiveness. Many parents believe that with the costs surrounding education and the limited economic capital, education is very much unattainable, and many girls are pulled out of primary school. It is therefore important to implement strategies that will also focus on changing widespread social values and beliefs.
The 5-year plan to reduce the prevalence of undernutrition begins with building schools in rural areas to improve access and availability, then making financial incentives available to parents for their child's continued attendance, and introducing a school-based nutritional program. With these strategies, we hope to see a 30% reduction in childhood undernutrition by the 5th year of implementation. gathering gender-specific educational statistics, which also includes geographic location, socio-economic status, and parents, in particular mothers' educational level, as well as childhood undernutrition rates, and comparing these with previous years will help us to identify if the strategies are working. Measurable outcomes for the programs are increased primary school enrollment, a continued school attendance, a decline in child-related undernutrition, and a reduction in nutritional-related morbidity and mortality. The stakeholder communication process involves community meetings at local primary schools, utilizing national media, publishing articles through the World Health Organization and UNICEF, face-to-face meetings with Cambodian government officials and affiliated NGOs, and an SMS text messaging service to parents. This will not only work as a means of communicating progress, but also as a reminder of continued school attendance. Undernutrition is a complex issue with many influencing factors, and such there are potential barriers and limitations which could be detrimental to our strategy. These include In conclusion, childhood undernutrition is a global health issue and leads to issues such as cognitive and physical growth problems and death. In Cambodia, it contributes to nearly half childhood fatalities. While it is an issue affecting the whole country, rural areas are worst affected. Microdeterminants such as parents' educational levels, birth intervals, and mother's smoking status, and macrodeterminants such as poverty and poor sanitation severely affect a child's ability to thrive. Children being able to gain at least a primary school education has been identified as one of the best ways of addressing and combating childhood undernutrition. Ensuring high enrollments, continued attendance, and a nutritional program are a priority. Undernutrition is not a simple health issue, and as such there are barriers and limitations which can affect the program. We want to measure the impact of the programs by utilizing quantitative data to analyze their effectiveness. We aim to achieve a 30% reduction in childhood undernutrition within a 5-year time frame.